the other great area of need and exciting advances in prostate cancer is liquid biopsy. So as many of you who do prostate cancer, either in basic setting or in clinical setting, as you're aware, it's very hard to get biopsy, tissue biopsy from prostate cancer metastases, given that they're either nodal, which is small and deep in the pelvis or the abdomen, or they're in the bones, which is typically sclerotic lesions, which tend to have lower biopsy yields. So there's a number of approaches to find the right target to biopsy. And in specialized center like ours, we use CT-guided or MRI-guided or advanced imaging-guided percutaneous needle biopsies to try to get the area of the lesion that appears to be most active and perhaps increase the yield that way. But at the end of the day, there is still about a 30% specimen failure rate. So the most recent estimate for specimen failure rate comes from the PROfound study, which is a phase 3 randomized study of olaparib. And in that study, they ended up sequencing about 4,200 subjects and with a specimen failure rate for archival tissue of about 30%. And so there's definitely a need for liquid biopsy approaches. Circulating tumor cell-based assays have been around for a number of years now. They've been used in prognostic settings. So Howard Scher and many others around the country have looked at CTC conversion, so early decline in CTCs, as a predictive marker or as a prognostic marker. And there does seem to be a good correlation between CTC decline and longer overall survival. So that's an area of developing data. But I think the challenge there being that CTC yield tends to be variable, and that workflow may not be appropriate for all institutions that want to do liquid biopsy. So the two other approaches that we're working on, one involves circulating tumor DNA or cell-free DNA, looking at plasma samples and sequencing that tumor DNA, looking at allele fraction and doing pipeline bioinformatics to assess what is going on in the tumor. And that has actually been shown. ctDNA has actually been compared with archival in a number of studies now, but the one that I always quote is from the lung cancer data, where they looked at EGFR mutations in ctDNA and compared that with the archival. And in fact, it does seem like ctDNA performs just as well, if not better, all things considered, compared with archival tissue. So I would not hesitate to say that ctDNA has a growing and perhaps even a more important role in the coming years when you compare that with archival tissue. And one final area that's of my particular interest is exosomes. So exosomes are these small particles, a certain nanometer in size, that are shed from all living cells and especially from dividing cells and especially from prostate cancer cells. And we've developed a methodology along with many other groups around the world on isolating prostate cancer specific exosomes. And the benefit there is that it basically encapsulates all of the transcriptome of the cell. So it gives you an idea. It perhaps adds value to ctDNA sequencing, because now you can look at the whole transcriptome. You can also look at that with a greatly increased sensitivity because of the sheer number of particles that are shed. So last year we presented this data that in our cohort of about 40 patients, in every mil of plasma, we were able to isolate 10 to the power 9 to 10 to the power 11 particles, exosome particles, on a consistent basis. So that's another area of liquid biopsy that may gain traction and clinical utility in the coming years.